Alright guys, my name is Kyle White. I'm a doctor of physical therapy. I specialize in treating orthopedic conditions and have multiple years of experience. Today we're going to be talking about whether or not these pulleys are safe following a rotator cuff repair. Now the quick answer to that question is yes, but there is a timing aspect to when we can and when we can't get into using these pulleys. Now this is surgeon specific, but for the sake of this video I've pulled several of my protocols from past rotator cuff repair patients and kind of summarize that data. And 4 to 6 weeks is usually a safe bet to start using these pulleys, and you can use them on a day-to-day basis to help improve that range of motion. The reason we're having to wait to that 4 to 6 week mark usually is that this is an active assist range of motion exercise. Active assist meaning that usually the unaffected arm is assisting the affected arm in gaining new range of motion. So if my right arm is my surgical side, my left arm is the one doing most of the work, and my right arm is just being pulled by the left side up into new range there. Now again, this is surgeon specific on the time basis when you can get into doing this exercise. I do have a protocol that has active assist range of motion being began in the first 0 to 6 days, depending on patient tolerance. But in my experience, that patient specifically was not able to begin active assist that soon due to pain. And so this, keep in mind we have these protocols, but then also let your body be your guide. Don't push through too much pain because we don't want to increase the inflammatory response that's already at work in that shoulder during this rehab. All right, guys, that'll wrap up this video. And by all means, I want you to ask your own physical therapist and your surgeon on when it is safe to use these pulleys, but usually 4 to 6 weeks is a safe bet. See you next time on Body Talk.